got your gavel. Good job.
Welcome, everybody. I'm Barb Higgins, the chairperson for the Instructional Committee. Welcome to the July 26th meeting. We're getting back into Instructional Committee meetings have a lot more weight because we're getting into planning about the school year. So our meeting tonight, before I take attendance and all of that, will really just be to listen to our administration explain the thoughts and ideas around going back to school and what we need to consider and think about. And I think at this point we just follow through with what they have to offer, and then we can have heartfelt discussions at the conclusion of the presentation. So committee members are Brenda Hastings, who is here, Pam Walsh, who is here, and Kate West, who is here, and I'm here. Other board members, Gina, Jim, Jonathan, yeah, okay, and administrators, Kathleen and Donna. So without further ado, Kathleen, let's go.
Okay, that's great. Thank you very much. I put together an agenda which follows pretty much a presentation that we're going to give to you tonight to hopefully answer a lot of these questions. But we've also had some other questions that came up. One, will we reach out to the families and our constituents and do some presentations? You'll see that on the slides tonight. We also made sure that I will present to the board on their full board meeting in August about the plans, and that will and it's on the agenda so that people will have an opportunity, should they have some comments, questions, whatever, at the board meeting, they can make comment. So we tried to accommodate all of those things because I think there's a lot of anxiety, you know, as we get ready to come back, and what's it going to look like and how will we be able to respond to the students. So you'll get a sense of that. The other piece that I wanted to share tonight quickly was around enrollment, just to give you an idea about kindergarten enrollment. So we have a slide on that to let you see. I'm kind of happy about what we're seeing with enrollment, and I think you'll feel the same way, that it's a message about our numbers in kindergarten. We don't have all the other numbers because, you know, I just kind of focused on kindergarten right now, but you'll get more of that. And certainly we're open to anything else. I kind of overheard a conversation about after-school programs. We're not prepared to do that tonight, but we're happy to come and do a presentation around what is it that we offer, but then are there other things that we might want to think about are offering our students in terms of after-school programs. So add anything to the agenda or topics that you'd like us to explore. Give us some time to put some thoughts together, and we'll come back with some information. So I'm going to let Donna worked on this PowerPoint. So I thought it would be really important to take a peek at it. Again, Donna, jump in when you want. Go ahead.
I'm not gonna. This is, first of all, it's in your board committee packet, and it's on the website as well. These were the same guiding principles that we've been working with since last year, since the pandemic started, actually, in terms of what our goals are in terms of what our principles, our guiding principles are for our work in the schools. Obviously, health, well-being, and safety, and moving students forward in their academic growth and in their social-emotional growth. We are definitely prioritizing full-time in-person learning. We are dedicated to that continuous monitoring, which we've been doing since day one of this pandemic, to make sure that we make good decisions, focused on Concord and Merrimack County particularly. We have learned a lot about prevention strategies and are focused on minimizing risk by adjusting those regularly, as we've been doing. We look at community transmission, we look at vaccination rates, we look at other local operating factors, and finally that we take our cues from experts who we regularly are able to consult with, including folks at the Department of Education and the human DHHS and our own consulting medical specialists. So those will continue to be priority areas for us. I wanted to start by just sharing some data, because if you're like me and you're at home at night looking at your feed on your phone, you're getting very, very anxious by reading a lot about what's going on in the world and what's going on with COVID. So I just wanted to show you this. This is New Hampshire's sort of COVID profile. So this is all of the days of COVID since last year, and the blue shows the daily cases, and the red is the is the 7-day sum. And you can see that we've come down, which is great, and we're mostly down. We're a little tick at the ends. The little tail is ticking up a bit. And this is the whole United States. So just because we're always thinking about like what's going on everywhere and then what's going on here. So, obviously there are other places where things are ticking up much more, but the pattern is somewhat similar. This is a comparison of 6 states. New Hampshire's in yellow. And so Arkansas, Florida, Missouri, Mississippi, California. So you can see there's a lot of places that have had more difficult situations with COVID. There are some that are really ticking up right now. We're hearing a lot about that, right? New Hampshire is in yellow, still doesn't have a tail going up much, but other people do. So I just think keeping some perspective on where we are compared to where other people are just gives you a sense of comparison. And then Merrimack County. So this was from, I think I was working on Thursday. We had 39 cases that day. And you can see our little tail, starting to rise up a little bit there on July 22nd. These were our numbers this morning. They hadn't updated it. It was updated on Friday, I guess. So at 40 cases over 14 days, you can see we're still in green. That minimal is below 50. Now we don't hit to moderate till we get to 50 to 100, then over 100. And then our positivity rate based on, 1,600 tests given, well below the 5% that we, would take us out of the minimal range.
Barb, did you have a question?
No.
Oh, okay. I thought you were going to point out something.
Yeah.
So just keeping those in mind, those are metrics that we've kept in mind all along in conjunction with local conditions and operating conditions. But those are still metrics that we look at. Ticked up a little bit, right, in the last couple weeks. So we can start with learning models. We're going to talk about learning models. We're going to talk about all the health and safety pieces. As you know, we had pretty strong remote learning going on in September and October. Our teachers really did a great job, hit the ground running on that. Had a really lot of positive feedback. Some teachers continue doing it all year. And then we had a lot of experience with hybrid, October to April, 6 months of that. We feel like if it's needed, because of transmission, because of cases, operational issues, that we'll be able to pivot back to that. Our teachers really learned how to do it well, and we feel like we have the capacity for it. But as we said earlier, our priority right now is in-person learning. And right now, families that are interested in a remote learning model have access to a free virtual learning academy. And I know you guys have talked about that quite a bit. Students who enroll in VLAX, though, if they need other services, are entitled and will receive special education-related services if they're eligible from the district. So that right now is what we've been talking about here.
Can I make a comment? One of the reasons that we looked at it like that is based on the survey. Remember, a lot of this information that we did tonight is based on the survey that we did in June, if you recall, where we had almost 1,000 parents. We had staff who also responded along with students. So using that data helped us to create where we thought people were at. And the number of folks that indicated remote learning was 27, 28, something like that, and there was still some that were undecided. So I don't want to dismiss that number either. But the numbers were very small with wanting remote as an option, and that's why when we're for your consideration the aspect of using VLAX. As a solution for those who are still reticent about returning full-time in September.
Well, and the great thing about VLAX is you don't have to unenroll and re-enroll. You can just sign up for 3 or 4 classes, and so you're still considered, funding-wise, the money goes to the charter school, but
Yes.
for those classes, but it's not like you're leaving your district. You're still considered a part of the district. So it's not like you have to leave your school to go to a new school, unless you enroll as a full-time student at VLAX,
Right.
in which case, a VLAX student. Those are two very different things.
But I still have concerns about, I understand why we would offer VLAX as the remote option. I agree that it does not make sense to try and run remote classes for 30 students.
Right.
But there is a difference, I think, between students who will end up at VLAX and students who choose VLAX as a charter school. Like, these are families who don't necessarily want to go to a charter school. They want to be part of the Concord School District, and they will likely be back
Yep.
as soon as their children are eligible to be vaccinated. I would like us to consider either, maybe assigning them to the classes that they will ultimately be in, so that they have a teacher that they're in contact with, or that we hire one teacher for the 30 students who is checking in with them regularly and can be a connection to bring them back into the district.
A connection while they're at VLAX?
Yes, like somebody who's meeting with them in small groups or individually once or twice a week to talk to them about how they're doing, keeping them in contact with the district as a whole. Because I think for a lot of people, VLAX is not necessarily what they want. It will be what they feel like they're stuck with. And they want to be Concord School parents. And so I think we have to figure out how to bridge that gap a little bit.
So any student with an IEP or a 504 plan will never lose contact with Concord because they have to,
Yeah.
because that isn't part of VLAX. I'm just.
Yeah,
So those, if in our 27 or 28 students, we have students with special needs, their services and anything that they get related to their IEPs happens here. So that connection is never lost because we have to provide the special ed services. And then in terms of just maintaining connection with your grade, that's an interesting concept. I do know, so for years I taught high school VLAX, and lots of high schools had VLAX labs and things in the school where the students that were taking classes at VLAX could do it right at school. Obviously, our parents would go to VLAX because they didn't want to come to school. So that the issue now is that the connection has to be some kind of virtual connection. But it's worth looking into. I just know, like, I teach little kids right now, and so a lot of them have things they still do at their sending schools.
Yeah.
And typically it's a guidance counselor. So all of our elementary schools have guidance staff. That's typically who the connection is. It's not the same as a classroom teacher.
And I get that.
Yeah.
Let's put aside the regular. I know you're a fan of VLAX.
It's not even that I'm a fan. I work there, so
Yeah.
I'm trying to explain how it works to you.
But I want to put aside like the regular people who regularly choose VLAX.
Right.
And talk about this category of people who we're saying you either send your kid to school, regardless of whether you
Actually,
think
that's most
safe.
of VLAX students now. They have to go there because their district. I have a lot of students that don't want to be at VLAX.
Right.
So it's exactly what you're talking about.
And
Yeah.
so I want these kids back in Concord. I don't want them to feel like they're not able to transition back
Right.
easily. We had a lot of discussions last year when we were trying to figure out how to reintegrate children who decided to come remote, and this was a big problem, and then they wanted to come back when we went in full time. I want there to be an understanding throughout the school year of where these kids are academically, what supports they may need, how they can come back into the school district and into their schools. I mean, we're talking about mostly elementary school students.
Is there
Since we're offering a remote option
Yes, but
for the high school.
Yeah, we are.
So
Right. Oh, I see. But the 27 that want remote, are they mostly elementary?
It was a range of ages. I think what I hear you saying is that idea like a guide for and a connector for those
Yes.
families. And I think that is what you're going to want to do. But I think you're going to want to do it on an individual basis. So in other words, I think that if a family is going to do this, I would think that they'd want to work with their Concord school and with people in their Concord school to help make the connection with VLAX and then to maintain the connection. Because you're right, we don't want to get in a situation like, oh my gosh, this class is now overfilled and we don't have room in this school for this child, so they're going to have to go. We don't want to start all that over again.
Yes.
That was a pretty involved process.
what I'd like is a plan from the administration of how we're going to stay connected to these students and whether we need to dedicate ESSER fund. I brought this up at the last time we discussed this plan, so I'm sort of frustrated that we're still in the same place. That, you know, a plan for how we're going to stay connected to these kids, how we're going to help them reintegrate it back once they get vaccinated, if that's what they choose to do. You know, and I think those numbers could go up depending on where we are on masks, which I know is another part of the presentation.
I would like to know, of the 27 that are sure they want remote, what the grade levels are.
Yeah, we don't,
I can get you that.
we'll have to go
Yeah.
back and look at the response in the survey, but, you know, from June to even now,
Yeah, right.
you're 2 months later, you're still talking about changes
Yeah.
in terms of where people are at, and I would agree that the mask issue is one that needs to be addressed for a lot of those parents. It is elementary. That's really elementary because we can do some things at the high school. We already said that. We would bring in a person to oversee the math science, social studies, English, and an arts, you know. So we planned on that because we knew that was a challenge for the high school kids. But the other kids are so spread out. You know, you're one here, two there in each grade level. It does make it more difficult. And when I looked at the costs associated with that, having a teacher at every grade level, I looked at that. Have a teacher at every grade level, and I was up to $1 million. I
get why that's not practical.
Yeah, so that wasn't practical because we've been talking about this, Pam. We didn't just ignore it. We were trying to figure out how we could do that and still meet the needs of youngsters,
So I have
but
a
things had
question.
changed.
So, Miss Higgins teaches second grade at Beaver Meadow. And I have my 25 students, but I have 2 that are remote at VLAX. Can they still be on my roster, like in parentheses? No, so that is that,
Yeah, it's a little tricky, but I actually do think that we can have a plan to have a very individualized approach, and I think it could happen in 2 ways. We could use ESSER money, for instance, to hire a person who's like a Pathways support, you know, a support person to families, and can stay in touch and make sure the kids are moving. But because it's going to be very, very individualized, some parents might say, we're only going to stay till we get vaccinated. Some parents are saying we're in for the year. Absolutely. Those are really different things. Somebody who's coming back in December versus somebody who's not coming back to the following year.
right.
And I don't think that we can ask a classroom teacher to take on 2 students who have totally other teachers. It would be like if you chose to go to St. John, but as a teacher, I'm going to go to St. John and check out how things are going, or I'm going to call you, or I'm going to.
wasn't that
They're
so much
learning
as
this
like a
different
placeholder,
curriculum.
like that was their place, so
Yeah.
that the class couldn't fill up because they're on
But
the
they might
roster.
be able to come to field trips, or they might be able to come to something special after school. Or
After
they might be
school.
able to join in on some sort of a celebration. You know, they might join a team if they're in middle school. So there might be ways to make those. They might be in the band or the orchestra. So there might be ways to connect them in some.
I like a district-wide coordinator. I also like, to the extent that we know, assigning kids now, because, or, you know, it doesn't have to be on the teacher's roster, but when, you know, and maybe the numbers aren't as big, but we don't want to do that shuffle that we did last year.
No,
Where, you know, kids were in one class, then they were in another.
We looked
it's
at
gonna involve that personal
class
conversation.
size. We spent a lot of time over the last few weeks looking at class size because we really were trying to keep class size reasonable. We knew that some children would return. We also knew that we wanted to keep the numbers down because we were anticipating the kinds of needs that our students would need as they came back to school in September. So the numbers are pretty good in terms of class size. Where they got a little large, we added, as you know, using our ESSA funds, we added teachers to keep those numbers down. And in our primary, our first grade, where we felt the greatest need would be, we added additional adults by putting in an educational assistant in those classrooms. We hired 17 of them. So that'll help out that if we have to add, let's say we add a kindergarten or a first grader. Let's say we add a first grader. I'll know that there's an ed assistant in there to help with the needs of those youngsters.
What is our normal ratio compared to the ratio I guess we're aiming for now? In the areas where you talked about trying to like boost, give more support.
So we have a range, and we have a middle number that we aim for. we could go higher. We can go to 26 or 20, depending on the grade level. Kindergarten, first to second, and third to fifth. We are trying to stay on the lower quadrant of that. We have a low number as well, so we're trying to stay closer to the low number.
What is the low number?
For
Depends on
for
the grade
K2,
level.
what's the low number?
For K, there's 3 different numbers, and I should know them by
18.
heart.
I know.
It's 18 is the high for kindergarten, and I think 15 or so is the low for
Yeah.
kindergarten. Then we go up to 21 for first and second, and then 3 to 5 we go to 26.
Yeah.
I think.
26 is low?
No, that's the
High.
high.
High,
That's the
yeah.
high.
But I
And
think
what's low?
I thought it was 28.
Oh, remember we lowered it though. It had
Yeah,
been
we did.
28.
It had been
Yeah,
28.
I think we lowered it down to 27 or 26. I'm not going to take. If somebody wants to go to our class size policy, you'll
can-
see it. I don't want to take this
No.
off the screen right
Thank
now
you.
because there's people
Yeah.
at home. But we can pull that up. Maybe right at the ends we'll pull it up and show you. But we are trying to stay at the low ends. So
And so class sizes that were put together last spring, if they were towards the high, you've added either an assistant in there to help, or you've hired another teacher to reduce the lower.
and we're still monitoring because you'll see
will
it's going to
change,
change, especially because we need to know how many kids are going to come back from private school placements or homeschooling
Okay.
or
So
charter
we want to
schools.
say it's still being
It's in
adjusted.
oh, it
In
is.
flux.
It's only July. Yeah, and it always is, anyways, even when it's not a pandemic.
Okay.
But we'll show you the kindergarten. I did gather up the kindergarten last week because I wanted to see where we were with that, and I think that's promising. But we are watching those numbers. We did add a fifth grade at Crystal McAuliffe School where the numbers were already at 25 and 26 in fifth grade. So that's fine. It's within our range. We just don't want them to be that high for this year. So.
So following up a little bit on what Pam said, and I understand the fact that if we have, and I'm just composed, 9 kids that are full VLAX at this point, and they may come back or they may not come back, and I can understand the problem, like I can't put 3 here, 3 here, 3 here, because I don't know which ones are coming back. I could have this one with 0, this one with 3, and that wouldn't be good. But to keep that continuity and keep touch of what, can we assign that to an assistant principal in the school? Because we know what schools they're from. So if we left them even have that assistant principal integrate with the person to make sure that they're kind of, just sort of kept in the loop, and, we know that we still care about them. And then you don't have to assign it directly to a teacher, though you know that the assistant principal has responsibility for that. Maybe that'll work, maybe not. I just thought I'd throw that out
Well, at the
there.
elementary level, they're attached to special ed as well, so,
Both, yeah.
and so that actually is a fairly logical solution, because they would be connected to the special ed students that were at VLAX.
Look at it, because we do want those kids to know that we want them back, and that we still care about them, even though they need to be fully VLAX at this particular juncture, and maybe through the whole year, I don't know.
Yeah, it's not like homeschool where youngster can be homeschooled for certain subjects and then opt to take classes at elementary, middle, or high. I mean, we see that. They might take, in elementary, they might take one of the art or music or something that maybe the family feels like that's something they wanted to do. And same with the high school and middle school. So they come in and out, which is great. I mean, they're taxpayers, right? They have access, and so we encourage that. This is just a little bit different where we have to save a seat for them. Basically, that's what we're doing. We're saving a seat for them, so we want to look at the numbers. But I like the idea of the assistant principal kind of overseeing that, since they know their kids, they know their school. That might be a good way to keep connected to them.
Okay, we can come back to that. The health and safety pieces, masking, distancing, hand washing, et cetera, we're going to walk our way through right now. So let me just start, and I think you know this, that we've had different kinds of recommendations. So the Academy of Pediatrics has said that everybody 2 years of age and older at school should be wearing face masks, whether they're vaccinated or not. They said everybody. They said that in early July. The CDC recommended face masks for people 2 years of age and older in indoor locations who are not fully vaccinated. New Hampshire's DHHS, around the same time, recommended masking use based on a local assessment of risk. There's generally an agreement that you don't need masks outdoors, except in very crowded sort of circumstances. So we have these 3 recommendations. And I first want to say, before I go further, that we also received a technical advisory that reminded us that we may not, first of all, require vaccination as a precursor to attendance or a prerequisite for attendance. And we also may not treat people who are vaccinated differently from unvaccinated people in terms of wearing their masks. We are not allowed to say, okay, our plan is everybody who's vaccinated, you don't have to wear a mask unless you want to, but if you're unvaccinated, you must. We're not allowed to do that. So that's just off the, in some ways it's good. It's off the chart. We don't have to, it's not an option for us. So just keep that in mind. So the CDC one actually wouldn't work in an implementation process, even if you thought it was a good practice. So here's a little bit more about DHHS and their recommendations. And then I'll talk a little bit about the reasoning for it. So again, right now, with low levels of community transmission, they're saying that you're safe to remove face mask requirements indoors based on the assessment of the local situation. We use that advice to make the decision not to wear masks this summer, and that's what we're doing. And as we've said, there have been 2 cases of COVID since June 1st in our schools. Not as crowded, different type of situation in the summer. And then, obviously, an option for people to wear face masks. This is the rationale. So there's a lot of text here, but they have talked about why is it that they think they can give us this kind of permissive recommendation. And they're talking about a local situation. Just like I showed you those maps of what's going on in Florida or what's going on. CDC is trying to make rules for everybody. So are the pediatrics groups. These folks are trying to make decisions for a more local situation, and they're suggesting that we can make a differentiation based on that. They're also wanting to keep in mind the risk benefits of masking. And the piece that we sometimes don't talk about is, what is the risk of a child wearing a mask for this length of time, for long days over years? And there is certainly the potential, because it's an experiment, nobody's ever done it before, even doctors in hospitals don't wear masks all day long, that it may be impacting the your respiratory system by suppressing certain aspects of it. So that is a thing, that's a possibility that has to do with the risks of mask wearing. So they're trying to mitigate, they're trying to find a balanced approach, be stricter when you need to, and loosen up when you don't need to be doing that. So that's the rationale. One more note, that there was a CDC order that came out in January, late January, that said, and it was issued in early February actually, that is a blanket requirement for masking on transportation conveyances across the United States, and that includes school buses. It was not talked about a lot. DHHS in their call last week said, we really didn't bring this forth, but you need to know that this is still in force. It is an order, not just most of the things in the CDC are guidelines, but this is actually at the level of an order, which is why people on planes and buses and boats or whatever else is a public conveyance has to meet. So just know that is an expectation. And so we get to this point, which is, certainly the decision needs to be based on guiding experts, consideration of conditions, vaccination levels, school data, and then a bunch of questions that we're hoping you'll talk about. So what are potentially the risks of long-term mask use, and what would be the metrics that would make one feel comfortable to take off your mask. So if you go back with masks when we're in the green, say, when we're in the minimal, at what point would we take them off? If we assume that COVID is endemic now, not just pandemic, but it's going to be endemic, it's going to be all around, at some point, we'll stop wearing masks. What will be that metric? What would be that level in the community? What would be the vaccination level in the community? How would we connect it with transmissions in schools? We still know, and there's more and more and more research, that COVID has not transmitted in schools. That the medical people are saying that when the COVID goes up in the community, schools get safer and safer. And that has proven to be the case pretty much everywhere, apparently. So Dr. Chen is saying that. Dr. Noble said that last week as well, again. So that's all the thoughts about masking right now.
Is there a
Questions?
recommendation or a direction? I mean,
Yeah, I know. It's
Well,
just-
we knew this was an opportunity for discussion, so I don't think that, we certainly have our thoughts on it, but I felt it was really important for the instructional committee to grapple with that issue. We gave you some data, we gave you some information, and we posed some questions to you that we thought were things that you had to kind of rectify in your mind and help to formulate a recommendation. I really do. Many of the emails that you get go to you. I try to intercept as many as I can and respond back to the families that email me, but you also get a lot, so you are part of that decision.
we can have separate policies for elementary schools versus high school and middle school, right?
That's correct, as long as they're blanket policies.
Right.
We're not treating the vaccinated people
Yeah.
at the high school differently than the vaccinated people or the unvaccinated people. So we could say, well, you have a chance, for instance, we've talked about people at the middle and high school have had a chance to be vaccinated, middle and high school people. So maybe they've taken that chance, or we'll give them more opportunities. So maybe they're ready to go maskless, whereas the elementary haven't even had a chance yet. Not to say that people will take that chance, the opportunity, but
The other piece that we have to think about is the percentage of staff that have been vaccinated. And we know that based on the calculations from last spring when our staff was vaccinated, we think it's between 80 and 85%. Nationally, this morning I heard that it was around 85, 86% nationally that all teachers have been vaccinated, and the goal is 100% to have teachers. Then they know, because that's part of that, whether they wear masks at the high school and the middle school also affects our teaching staff.
Yes.
So,
Which has nothing to do with the age of the students.
right,
Right.
and so that has always brought a great deal of anxiety in terms of what decisions we make around wearing masks or not wearing masks. Different in the elementary
Yeah.
because none of those youngsters
Right,
have been
right.
vaccinated.
So in the concerns that come from community members, I have some neighbors that have kids in different levels and such. First of all, are we wearing masks or not? And my belief right now is that we need to start the school year wearing masks. It doesn't matter what grade you're in, or what you've had for vaccines or not. My feeling as the person, on paper in charge of this committee and who will take a lot of heat, whatever we decide, I feel like safety is the best measure, and a mask is an easy thing to put on and take off. That's just my general feeling right now. What I get when I have these discussions with community members is now they want 50 million, well, what about this, what about this, what about lunch, what about recess? Okay, we're just gonna wear a mask to school. And where the differences come in between grade levels, elementary school has recess, middle school and high school don't have recess where they go and run around and play. Well, in my mind, that's a logical place to remove a mask. You're outside, you're running around, you're not necessarily on top of each other, you're outside. So that's where I feel that the flexibility comes in terms of what policies make sense for elementary school versus middle and high school. But I do feel it's a very, very slippery slope. Even if the high school is the safest building because the largest number of those people have been vaccinated, we don't have the right as a public entity to ask somebody if they've been
That's right.
vaccinated or to treat them differently. And all that Exeter prom stuff on the news there where they were trying to do a safe thing, but you end up singling people out whether or not they've had a vaccine. I just feel when push comes to shove, put on a mask. And I want kids to be in school. I don't want our district to have to pivot. I hope I never have to say that word again. And I think a really easy way to avoid that right now is just to, it's July 26th. September 1st could bring a whole different, this could be a silly conversation on either way in 6 weeks. It could be like, oh my gosh, we were so worried about masks, or oh my God, we thought we didn't want to wear them. You know, like, you don't know what's going to happen. It could be horrible, or it could not. But at this point, if you know, my general feeling is that if I were sending Jack to school, I'd want him in a masked environment, and that's just me as a mother.
But that would be an option for him
Yes.
to wear a mask. And I just don't know that a blanket statement from the school district is what we need at this point.
I mean, masks work best when two people are
Yes.
wearing them. Me wearing mine protects me somewhat, but what really protects me is somebody not sneezing or dropleting on me.
I understand, but my understanding is we're in the minimal category right now.
Yeah.
And we have had 2 cases, and they were siblings, I believe, since June. And we have testing kits that are going to be available at the schools for anybody who has a symptom. I like giving people a choice. I don't like taking away choices from people. And I feel like right now, we wouldn't want to necessarily, as you said, come August, come September, it may look totally different. But right now, I don't know that I would be comfortable making a blanket statement for September in July.
I respect wanting to give people choices. I also want as many kids to feel comfortable going to school
Right.
as possible. And I'm really afraid if we don't require masks, at least in the elementary school, and I'd be comfortable limiting it by ability to get vaccinated and sort of time it to the question of when does it end, you know, in a certain period after vaccinations are available. But, you know, I think kids that have health conditions, who are the who are the most vulnerable in other ways, who may need to be in school the most,
Right.
are most likely not to be able to come because of if other people aren't wearing
Right.
a mask.
Well, it's almost like smoking on airplanes. You know, the smoker, well, you can't smoke on an airplane. Well, you're not smoking doesn't hurt you, but your smoking hurts me. So when the choice to do something hurts the people around them. So for example, if Jack were going into kindergarten and, if you want to wear a mask, wear one, but you don't have to, I probably wouldn't send him because
But
Kenny
that
had
would
a-
be your choice.
to not send my kid to school? No, it wouldn't be my choice. It would be what I have to do because half the school's not wearing masks. Kenny had a kidney transplant. I can't have somebody bring home COVID. It would kill him. So if we have a mask mandate, then all children can go to school safely. That's just my perspective. I understand the choice piece, but, choosing to create a safe environment to me is a logical choice. That's the choice. I would lose my choice.
I would disagree with you. I guess
Yes.
I would disagree with
But
you
I
on
would
that.
lose my choice. I wouldn't feel safe sending my child to school. Because
And what about parents that don't feel safe or don't want their children to wear a mask in
Right.
school? You've now taken
So-
that
right.
choice away.
So, and here we are.
Right.
So this is no different than
Right.
any of this has
To
been.
carry on what Barb was saying, I think the whole thing we're also missing is like testing is way down. So we also don't know really how pervasive COVID is with younger individuals
Right.
who are also known to carry it asymptomatically. So it's not only for the younger individuals, but it's for that they can carry it to other unvaccinated
Right.
people because we don't actually know how widespread it is in fact.
And it's not just other unvaccinated people.
Yeah.
It is also, there are people who have been vaccinated that we don't know because of their underlying health conditions,
Right.
how effective the vaccine
And
is
that's
ultimately
kind
going
of-
to
yeah.
But if this is endemic now, when do we stop wearing masks? When do you feel comfortable not wearing a mask anymore?
I mean, at that point, I would be comfortable when children can be vaccinated because then I can protect my child. If you choose not to protect yours, that's up to you.
Right, right.
And then once, the difference with the vaccine is you may still get it, there may still be breakthroughs, but the risk of death and serious illness plummets.
Yeah.
And, I think we want kids in school, I want them doing as many things as possible with the least restrictions as possible. But I want every kid to be able to go to school. And I think when it comes down to the choice of not wanting to wear versus the choice of I'm afraid my kid is going to get a serious illness that really hurts their health or hurts the health of their father, then, I don't think it's an equal choice. That's where my opinion is. I think that child's right to go to school safely, in my mind, is greater than the inconvenience of wearing a mask.
But is it just an inconvenience, as we just were presented? They don't know the long-term effects yet of wearing masks.
Well,
Are
there's-
you?
There's face shields and other ways to cover as well that we could also discuss, especially for kids that maybe are asthmatic or whatever. Like,
I
know
just
where-
think it's a bigger situation than just yes or no.
Oh,
I think
agree.
there's more to think
This
about
is a
on
healthy
it.
conversation.
Yeah.
And that's why you needed to have this conversation, because there are that many aspects
Yes,
to this. And
yes.
it wasn't easy, cut and dry, yes or no. You're absolutely right. And there's so many factors, and this conversation for you as a committee was important tonight.
Well, and I've thought about it. I've thought like, okay, so if we had protocol for masks, so when you're passing classes and coming into the building and leaving the building, going to the ladies' room or the men's room, walking to the cafeteria, you have your mask on. Once you're seated at your desk or seated at your lunch table, well, perhaps it can come down and you have it off because you're in your place. And, I know this gets overwhelmingly tedious and nitpicky, but that way, a child isn't sitting for 8 hours with a mask on the whole time. It can come down, I'm reading quietly at my desk, I can take it down. I'm going to stand up and talk, I'll put it back on. Like, I don't know, if that's over controlling it, then, it's one more thing.
And we will still encourage the outside for as long as we can, and we will be bringing back more tents. We took some away over the summer, but they will return at the end of August. They'll be put up at each of the schools, so we'll have that option. And the teachers did a lot. I mean, there were a lot of folks
Well, we can schedule
outside.
mask breaks.
Right, and schedule mask breaks, and when the kids are outside and they're playing at recess and so forth, then I think that's part of what, should they wear masks or shouldn't they, but we're outside, they're not as affected by the droplets and so forth, so.
Kate, do you have thoughts?
Yeah, I agree with Barb. I think that if we started with everyone wearing masks when we come back, especially I think the elementary, but I think that if we started with everyone wearing masks and go from there, I agree that, it's the kids that are scared to contract COVID, I want them to feel safe coming to school, so.
And for the kids, really, that it's taking it and carrying it, you know what I mean? It's bringing it home. That's the issue, or to the adults that are in those classrooms, those teachers, those paras, those tutors, all the folks that work with us. That is a concern of ours.
When I look at like the repercussions of it, okay, we're not going to mandate masks, and then we have this, numbers go up in Concord, and now suddenly we have to go back to masks. It's so much worse to have to go back to it than it would be to say, hey, first 6 weeks of school, nothing, we can ease back. Like, it's easier to take them off than it is to
Right.
have to put them back on.
Right.
So I think about that aspect as well.
What would your trigger be for taking them off if we did it for all the schools? And,
I think it would be consistent monitoring of levels in Concord. I don't care about Merrimack County, I care about Concord. And I think it would be, specific numbers in our buildings, but
see, I feel like if that's
Yeah,
the standard, then we don't start with masks.
yeah, right.
Like,
No, I get it. I don't know.
I think if we're going to do this,
This
we
is-
should figure out the standard. I mean,
Yes.
for me, the standard is vaccination, but if there's a vaccination availability.
Right. Well,
But
that
if
for
there's
elementary,
another-
that would have to be it. I just think, I wouldn't want to be the reason. I wouldn't, as instructional committee chair, I wouldn't want some child to get sick and have issues and know that I agreed to not mandate masks. I would own that responsibility. So
How would you know that child got it at school?
I wouldn't know.
Right.
But I
But
wouldn't
you
know.
know,
I wouldn't know he didn't
but
get it at school.
you would know he probably didn't get it at school if he was wearing a mask.
Correct. Where was that child maskless? At his family reunion. Yep. At a lot of my family members'
It's-
houses.
With the vaccinations, I'm just thinking, or I'm trying to understand, you're saying if everyone has the availability to be vaccinated, but like you were saying, you know, we don't know who's going to be vaccinated.
No, but I think, to me, that's the choice element of it. Like, I can choose not to protect myself or my child and my community, and I have thoughts on that choice that I'm not going to go into here. But you know, that doesn't necessarily, you know, but another kid can choose to be protected and they can still go to school and be protected there. Whereas if the mask, you know, when you're dealing with an 8-year-old who has underlying health conditions, you know, it's either, you know, if their classmates aren't wearing a mask, then their choice may be, the only choice they may have is not to go physically to school because it's not a safe place for them. And for me, I want that choice. Once you know, I would set the policy to expire once vaccines have been available for
all ages.
For all ages for a certain period of time. You know, I don't
Right,
think we'll
that
have the
makes-
vaccine rollout shortage that we had in the past. I think it will come and people will be able to do it within a month or so. And I wouldn't, you know, but that's just me. I would.
Well, there's more research going on as well. So Kenny's on anti-rejection drugs. So he's had a vaccine, but they don't know if it worked or not. And the blood test for antibodies doesn't give enough information, so you can't really, so he doesn't know. So he masks up for the most part when he does anything out and about. And he may have to have a booster, but this is all research too. So maybe in 2 or 3 months, we'll start to know that a booster will make these people more protected. So, but at the moment, these people could have been vaccinated and not be protected at all. So if you have a child with that type of illness who couldn't get the vaccine anyway, it's almost like double, you know.
Well, then that goes to the point, I'm just playing, I'm all over the place on this.
Yeah, no, I know.
So vaccines are available for elementary school age children. We don't know who's been vaccinated and who hasn't. How do you feel more safe now sending Jack to school?
No, not necessarily.
Right,
Not
so
right
you're
away
never
anyway.
going to feel safe.
Well, not never, but I mean, I think this entire thing will run its course. So maybe in a year from now, I'll feel safe sending him to school.
So for a
with
year,
mask.
we have to have everybody wearing masks?
No, for a year I can send my child with a mask, but I do think right now, it's not a year from now. I think right now, our responsibility is to every child in the district. So what's worse, having every child wear a mask or not wearing masks and increasing the risk and forcing parents, like I would have to do, to not send my child to school because I can't risk Kenny? It's not even Jack I'm worried about so much.
Right, but where's the threshold? Is it numbers? Is it vaccination ability? That's what we've got to.
Is there a
come up
Santa?
with.
Is there not a
Right,
Santa? I mean,
Right, but we have to have something.
you know.
I think the question will be for you is to which offers the
Right.
safest component for protecting students and adults.
Yeah.
What is the safest avenue? And so if we were to create that in a matrix, what would make us remove our masks? What's the one thing that we know has done that for us? We're all sitting here tonight with no masks on.
Right.
Why? Because we've all been vaccinated. So I think the vaccination issue is key to this right now. It looks like the vaccinations will be available probably early winter, sometime in January. That's what they're saying. So that would be your timeline. If it came sooner, it would, you know, again, we would take advantage of it, just like we did with the high school and middle school. But
Did you want to say something, Gina?
Well, I think what we're talking about, and we're going around and around about this, but I
Okay,
think
so we
what we're
do.
talking about is overall community vaccination rate, including everybody over the age of 2. And when you, I don't know what Concord's numbers are. I know
56%
Right.
today.
Okay, so I think nationally it's something like 58 or 54 or something. It's not. So I mean, I think when we're looking at
48, right?
a much higher number of overall community vaccination, that would make me feel more comfortable.
That's actually a good point
Yeah.
too. I think, you know, if community vaccination rates hit 75 to 80%, then I think that's a different story. But we're pretty low still.
Yeah.
We're actually 48.
Oy vey.
Even better.
No, the country.
Country.
I think it's something like that.
Oh, okay.
The country.
48
Yeah.
for the country, okay.
Yeah.
But I think what we're talking about literally is community vaccination rate, not our students, not our teachers. You know, we're talking about the overall community, which, you know,
Right,
right
or-
now doesn't include anybody from the ages of 2 to 12. That's 0.
And there comes a certain point that if people, you know, I think there's going to be a percentage of people who will never get vaccinated, and I'm afraid of how high that will be. And there comes a certain point that I'm not sure the rest of us can live our lives to protect them.
Right,
But I think it is important that we could do like kids can get vaccinated, or the community vaccination rate hits such a
Yeah, because that's a
threshold
much more
that
black and white. This is the number. Out of every 100 people, 55 are vaccinated. So we're wearing masks. Out of every 100 people, 85 are vaccinated. You know what? It's like that herd immunity sort of threshold where it's safe enough that the likelihood diminishes profoundly. It's the students that go home to unvaccinated families, you know, and their parents work out in retail or work, you know, are out and about. So that's where the mask in the building keeps all of that at bay, somewhat.
we don't know. It doesn't appear to be more dangerous, but it's more easily transmissible,
Yeah.
you know, with Delta too, and you know, and that could facilitate spread.
And here we are. We've been at this place a
No,
million
it was a
times
good
in the past
discussion. That
12
was an
months.
excellent
No, Brenda,
discussion
thank you.
with
It's
all
good-
sides.
It's good to hear the other side. It's
Yeah.
easy to get, you know, if there is, it's all sides. It isn't this side and that side. Really, it's just all of it. We all are driven by our fears and our concerns and what matters to us. You know, and I don't diminish people not wanting to wear masks at all, because it's not necessarily a comfortable thing, but I do feel very strongly in the big picture, you know, piece of paper over your face a few hours a day is a small price to pay to keep people safe until we have a better handle on vaccinations and really being safe. And that's how I feel.
Chairman Richards, did you have any thoughts?
No, I enjoyed listening to the instructional committee do its job and
Yeah,
talk
he gets to
about
listen.
things.
That's right.
And
I'm chairman right now, excuse me.
and I'm very anxious to see what the presentation is to the full board on August the 3rd. Is it the 3rd, I believe?
Second.
And I will remind everyone, as I always do, that there's an opportunity for public comment during that meeting, as there are in all of our
That's right.
monthly board meetings. So I think you guys did a good job.
I do, and I think you need to be prepared, because you are going to receive
Right.
concerns of people who do not feel that students should be wearing a mask.
Right.
And we've already seen indications across the state where there have been lawsuits filed against school districts who had a mask mandate, and they felt that it was a sign of restraint. I mean, there were all kinds of
Oh, yeah.
issues around it. So,
That got
I mean, I
dismissed, though,
think the
didn't it?
conversation is important for you as you defend position, whatever that position is going to be, that you're prepared to do that, and especially with this situation.
Are you looking for a
gonna-
recommendation to come out of this committee for
Yes,
Monday?
absolutely.
Okay.
Can I?
Yeah, please.
I just want to throw in one other piece, that I want to remind people that for students who are hard of hearing, students who have speech issues, wearing masks is incredibly challenging.
It is.
Not the physical act of wearing the mask, but I have people, I have to ask all the time when I go out. I mean, I know that we're vaccinated, but when I go out in the real world, I'm wearing a mask, and I have the hardest time figuring out what people are saying, and people are getting tired of being asked, "What did you say?" Well, you're wearing a mask, can't you hear? Well, the mask doesn't
great
affect
point.
my ears. You know.
Do you think that there should be an accommodation
Yeah, like this clear
for
mask, the
students
clear
in the
sheet.
classroom in that case?
We do have those clear
Yeah, I was gonna
masks.
say,
They
but-
go a ways. They're not, it's
Yeah.
not perfect. You're still I think what I hear you saying is you're still got an impediment in front of your, you've got a piece of something in front of your mouth.
It's difficult to
And-
hear,
Yeah.
and it's
Yeah.
difficult to use because you fog it up.
Mm-hmm.
It's difficult with trying to lip read. I don't want to forget our students who have speech
Right.
issues and students who have hearing issues.
Well, we accommodated them last year. Yeah. I mean, didn't we?
Best we
Try.
could. We use FM systems. We use a variety of different accommodations,
Yeah,
but
right.
it's probably not perfect. But yeah.
Well, and I guess I would encourage if we go this way that teaching staff be provided with
Whatever.
shields versus having to wear masks, so that they can their lips can be seen by students and maybe a little bit better understood.
So we talked about shields a lot very early on because we thought they'd be a lot better for people to work in, but they are not protective. So they're not masks. They're not considered masks. So they're not
But we're
protective from the
hoping that
virus.
our teachers are vaccinated, right?
Right, but just as an aside,
So
they're
we're-
not protective.
yeah. I'm just thinking it might be better from a teaching I mean,
Yeah.
I don't want kids just in school as being, so parents don't have to do something. I want them to learn while they're in school, and I think it's going to be easier for them to learn if they can see their teacher's mouth and expressions. I think that's all important.
I think what you're saying though is that at that point they just shouldn't wear anything.
Correct.
Yeah.
They should just not wear the shield. The shield is not masking the virus.
Would a masking policy be universal, including teachers and students?
Absolutely.
Well, because you can't
You-
go vaccinated, unvaccinated. You can't.
Right.
You can't publicly.
No, I guess
Right.
what I'm asking is regardless of teachers' vaccination status.
Right.
It would
You
be
could.
everybody at the moment.
Everybody
You
would
could
need
you
to wear
could say
masks.
all the teachers have to be masked and the kids don't. You could say all the food service people have to be. You could theoretically do that. Yeah.
So we could
That's
say
what-
that
that's what I was
students
saying.
would need to be
Yeah.
masked, but teachers don't.
Yes, but we don't know that all our teachers have vaccinated.
And we don't know that-
And
we
our
don't
staff.
know
It's
the-
more than teachers, but
Right.
all of our staff.
Right. And we don't know
And we
the
don't know who they are.
percentage.
That's right.
Correct.
It's not fair to,
Yeah.
single people out.
Our teachers are our role models for our students, and to have them run under a different set of circumstances than our students would be.
But can you see why it would be important for children to be able to see the teacher's face?
I agree.
There's a
I
definite
agree.
difference
I
in the
agree.
teaching
I agree.
um,
I agree.
Yeah, very
success,
much.
I think, with a mask and versus.
But we
not.
all know that we need to slow down when we speak, and we need to speak loudly, and our teachers have done that, because that was one of the ways in which we could overcome that deficit by wearing the mask. And I think we've seen that at our board meetings.
To which I am profoundly grateful.
One thing that Dr. Chen talked about was the same kind of issue of like, how do we know when to take them off? So we're doing well. Well, maybe it's because we're all wearing masks. We take them off, we won't do well. He said that's why they gave us this permissive period of time in the summer. It's not the same. We don't have as many kids. Some of our schools are pretty busy though, but it's not as many kids. So just that's a piece. Another piece is you start with masks and you play out this variant and see, assuming that depending on where things are at the week before school starts or whatever moment
that's
you
just it.
decide on, and then you go ahead and do it for a month. And you get started with masking, and then you have to make that, rip the Band-Aid off, and you have to try and see, and then we'll know. There'll be transmissions. The good news is that everybody vaccinated has some level of protection, right? And kids, as we know, are getting mild, for the most part, mild situations. So we've had no very, very, very few hospitalizations, and thank goodness no deaths under the age of 19, I think, in New Hampshire. So there's those kinds of ways you could go. Pick a period of time, and then try, and then see, or try it with the older kids, and then the younger kids. I mean, there's different things we could put in play.
I'm not sure that for families who are trying to plan for the upcoming year,
Yeah, we can be wishy-washy here.
yeah, like I think
Or
we need
wait too long.
like I think we need to tell or wait too long. I think we need to tell them what the guidelines are going to be and what like our decision tree is, and I think a combination of community vaccination rates and availability of an elementary school vaccine are two good, easy to understand indicators.
I want you to recall what happened last year when we were trying to follow the matrix. And we had outbreaks at nursing homes, at the prison. Remember that? And so the numbers in Concord skyrocketed, but it didn't affect the schools at all. The school numbers were still very low, and so it did present a challenge for us because we continued to be providing in person through hybrid, but we were still in person. So the circumstances change. Around COVID and what it looks like. We all experienced that last fall.
Since I know the new guidance from the CDC says if you're vaccinated and you're in close contact with an individual, they do not necessarily recommend getting tested. Do we have a policy in place for school? Since we actually do not understand vaccination status, are we still alerting individuals if they're within close contact?
It's an interesting question. We're going to get to it because there's no more quarantine for close contacts except for household contacts, and people have sleepovers. But if you're a contact in a school, there's no more expectation of quarantining. Partly because of pretty much low yields, like most people didn't end up getting COVID who were the close contacts. Now again, you could say it was because you were wearing masks, and so you had that extra layer. So it gets very cyclical and hard to understand.
Can we move on to distancing because there'll be some other questions, or do you want to address this particular issue?
I actually think we should talk about distancing and then.
All right, let's do that because
that-
we have some slides that will address that, kind of what Jonathan just talked about. Go ahead, Donna.
So the general guidance now is we are aiming for 3 feet. But at the same time, they're saying don't exclude people just to keep a minimum distance requirement. So our advice right now is that we aim for 3 feet. It's what we've been doing since April, I guess, and it's had a good result in terms of not a lot of cases. So that is certainly a continuing expectation. The same thing with cohorting. They're saying cohort when you can. It's easy when you have a little preschool classroom or you have a kindergarten class. They're mostly, they may go do a few other things, but they're mostly, at least in school, in one place. It gets harder, obviously, as the kids get older. They're saying it's not meant to restrict in-person learning. So that's what we're thinking right now about physical distancing.
So I did my track camp this summer, and when I read all the camp guidelines, for the first day, for our first big camp meeting, I had everyone bring masks. But we ended up not using masks at all. But I changed, certain things I changed. I didn't have event leaders. So I didn't have a group of kids teaching something to the whole camp at the end of the day. You had your group with your leaders and you did everything together. All of those little things, sort of common sense, quite honestly. I had hand sanitizer. I had 90 kids and nobody got sick. It was all, it was outside, but we really did take care to keep the groups, within groups, the cohorting piece, and just, really up the washing and that sort of thing. And this is just basic. It's not mask on, mask off. It's just distance.
And I think people also, the administrators did a great job of rethinking entrances and exits, making it not so congested. I think probably they're going to want to continue to do some of those things, maybe going in more doors than they normally went into instead of all going into one door. So I think those kind of, hallway etiquette and trying to make things happen. But again, not to say, well, we can only fit in this many people, so we can only go 2 days a week. We're not going to go there, at least at where COVID is right now.
When we went back in the spring, did we have normal size classrooms, with the normal number of students?
No, we had about maybe at the elementary, maybe 18%, 15% fewer because they were staying remote.
Okay.
Somewhere in the sort of 15 to 20% fewer because of our remote
So
loss.
if everyone comes back, because I don't know that we would have that number of kids remote, are we able to even?
Yes,
Okay.
we know we can do this. We can, in some places, we can be further. It's not that we have to be 3 feet apart. We can be further apart if it works, but we want to try to aim for 3. It may not be a perfect 3 in every single class. So you might have a high school class that can't quite get to 3, but 3 is pretty close. If you measure out your mouth to here, it's for people that aren't intimate, that's pretty close. So I think that few people are feeling pretty good about the 3 feet piece, knowing that we won't always hit it, but that we're going to aim for it.
Yeah.
Ventilation continues in the same way. I mean, we were really not lucky. Our district has done a good job with HVAC over the years, and it showed. We were ready for this, and we were able to run 100% outdoor filtered air with lots of exchanges per hour. And we change filters, and we have good consultants and experts to work with, and we'll try to keep going outside as much as possible. So that will continue. In the hand washing and the respiratory, I think we want to try to come down a bit on all the disinfecting wipe businesses, because that's some chemicals that we probably don't need to continue to, but good hand washing and good etiquette for that. Staying home when you're sick, this is a massive mitigation strategy. It's what's keeping us, from. It's probably been very helpful.
Like the plexiglass around the.
They moved away from plexiglass. We never went strongly into plexiglass, only in places like
the
the
main
receptionist.
office, yeah.
Oh yeah, and that's probably a good idea all the time, right? So I felt good about those supermarket people who are suddenly able to have something in front of them and their person, which probably works all the time. They're going away from. I think we had known early on that we had read some things and heard some things that plexiglass can disrupt the airflow in rooms.
Oh yeah.
And so because we know it's not. It's aerosol. That's known now. Originally, we thought it was droplets, and they went 6 feet and then fell. But now we know that it's aerosols, and if you're in a room long enough, you're all going to have it. It doesn't matter how far apart you are. That's what's also making the 3 feet thing work for us. It's not really about 6 feet. It's up close if you're sick and you're there for a minute. But if you're sitting in a classroom for an hour, the aerosol will spread across the room. Doesn't matter how far apart you are.
Yeah, when they turned it orange and it's
so not so much the plexiglass, but yes. But anyways, keeping kids at home is important to us. Screening, testing. Wait a minute. Was there something more here? Oh, we won't be doing screening at the door. They're suggesting you don't do that any further. They're suggesting you don't need to fill out forms. Again, the yield on that was very, very low. It did not keep virtually anyone out. So we'll stop doing that. We had already stopped doing that, actually. We are going to employ a full-time LPN whose job it's going to be available to give rapid antigen tests. Those are the tests that use a nasal swab, not the one that goes so far up your nose, but not quite as far up your nose. And the results are there within 15 minutes. And that way we'll be able to, we're hoping to head off that real challenge for schools, which was keeping kids who had symptoms, keeping them in place, calling their families, getting someone to come, and then going to find a test place, and then getting the results. So this way we can do it ourselves. There's some work that we have to do some forms and permissions, and we're working on that as well.
So I have a question about that. How are we, or are we, trying to parse out kids with allergies, with postnasal drip, which causes a sore throat, which causes, people to feel uncomfortable, and they're sneezing and they're coughing and they've got a sore throat, which, oh my God, is 80% of the symptoms of this new variant. How are we parsing out, or are we just going to test everybody? I mean,
so we've been doing that for a while. The most important thing has been communication between the primary care person and the school nurses. So to the extent possible, and I think families and primary care people did a good job of letting us know, okay, Gina has this allergy, this is what it looks like, this is typical. So you remember the screening checklist, if you look at it, it says unexplained symptoms, right? Not just
we're not
any
doing the
old
screening
symptom.
anymore. So now,
Well, we're asking people to still screen at home. Sorry, I should have said that. We're not doing it at the door, but we're still asking people to screen at home for so we're hopefully looking at unexplained symptoms. Now, is it perfect? No, not everybody's able to give us that information, and so we'll err on the side of it's unexplained unless we truly know that this is a situation. And because it's a pretty low risk kind of situation to put a nasal swab in someone's nose, we can do it.
yeah, I'm just wondering, we've got 4,500 kids, and now all of a sudden we're going to be testing every single one with allergies, but
We have a year of experience with it. It wasn't, we sent kids home,
Yeah.
but I think the nurses have a good sense of how many that was, and it wasn't everybody every day. So it's.
I'm just
No, I know.
just
It's
beginning to think, oh my
it's-
God.
I think the other advantage is the nurses know their kids. And they know the students and they know the particular, allergies and so
Susie
forth
gets the
that they
stuffy
have.
nose at math.
Sure.
Yeah, there you go.
That is so true. Probably a stomachache, but yeah, it could be a
Somebody
stuffy nose.
get math.
Yeah.
That happens every
Yeah.
fourth period.
Yeah, yeah. So, so that's the screening testing. Contact tracing, we'll still do it. The department does not want us to report one case anymore to them. If we have a cluster, which they define as 3, they said if we have 2 and we're worried, we can call them. We can always call them, let me say that. They're very, very kind and they're great to work with. But they'll want to know if there's 3 that are connected to each other. So we'll still work with them. And know that they changed the quarantine rules in New Hampshire, so you no longer quarantine unless the contact is a household contact. That's described as someone you're living with, or if you have sleepovers, that would be considered that kind of contact. Otherwise, if it's just a school, like I happen to be sitting, next to somebody, they're not going to be asked to quarantine any longer. But they are asked to do something called self-monitoring, and there's a little guide for just basically looking for symptoms, like being careful. And then if you're vaccinated and you're a close contact in a household, you're not required to quarantine either. But if you have a diagnosis, you still have to isolate and do that part. So, the DHHS people are wonderful to work with. Our nurses are great at doing it. I think we'll keep a contact tracer in our pool of people that will help, depending on how it goes. We may still need to do some of that. We still will inform. Oh, well, I'll come to that in a bit. Promoting vaccination, something we're still doing. We talked about that. I'll hear back, I'm sure, from public health about clinics that we can do. We certainly want to encourage it, and we know, like some of you folks said, that vaccinations lead to lower viral loads, shorter duration of symptoms, lower risk. So even if, I've been vaccinated, but I've had COVID, or I get COVID, I'm not going to be shedding as much virus, so I'm not going to be as contagious as I would have been without that vaccination. So, cleaning and disinfecting, we're going back to pre-COVID cleaning and disinfecting protocols. Social emotional supports, certainly. I know we've talked, I don't want to spend much time on this. We've talked about it a lot with you. What we're doing, we're adding a lot of staff and programs and professional learning. Same thing with academics, adding support, targeted support. Lots of summer programs going on. Communicating information, we will still notify parents and guardians of close contacts of a COVID-19 diagnosis. So if someone in your class is diagnosed, we will still let parents know, and we will still let schools know. We're proposing that we not write letters to everybody about every case, that we maintain actually a chart on the website that we update daily, or as often as there are cases, so people can look to see what's going on. We worry about just constantly kind of making people anxious by just sending those things out. They'll still look if they want to, but they don't have to know. I don't know what you guys think about that.
I think that's fine.
Yeah, no, that's good.
Food service, breakfast and lunch will be free at school this year for everybody. We still are trying to, and really encouraging people to fill out their forms, and we'll promote that. And if we have to return to remote learning, we would go back to delivering. Transportation, we are still going to ask families to transport if they can, if it's been helpful.
To keep
Just to keep the bus
down, yeah.
population down. Yep, and then that masks being worn on buses part, is a piece. And then this is about the information sessions that we want to hold. So we're coming back on the 2nd to the board to talk about the plan in more detail or in more specifics. Informational Zoom sessions proposed for the next day, Tuesday, for staff, Thursday, 2 different sessions for families, one geared to the youngers, one geared to the olders. I think we've talked about the fact that we've been holding in-person sessions at Keach Park with interpreters, and so we propose to do a session in August as well with the interpreters in person that anybody could come to, but we'd also have interpreters there. There'll be Zoom meetings And then we will see what our attendance is like, what we're hearing from people, and we can schedule more of those if there's a need and an interest. And any changes to the plan, right now, obviously these are based on current conditions, and if they change, then we'll share those in public meetings and using Parent Square communications. And I just wanted to mention the summer school protocols, which I already did mention, that they were optional this summer. Some kids are wearing, some staff are wearing, and we've had 2 cases that did involve siblings. So, other thoughts from the group?
Well, I feel, as difficult as it is, that the committee needs to present some sort of front on one side or the other for our board to discuss and vote on next week. So, my feeling is that I would like to move that the instructional committee support mandatory masks for the start of the school year. I'm also sensitive to all the facets that go into this, and so I'm willing to have a discussion on how or what we want to vote on to present. I mean, that y'all know how I feel.
Are you saying all schools, like the middle and the high school as well?
So I just drafted 2 potential options
I
with
love her. She drafts things.
with sort of indicators, and then we can debate whether they're appropriate, but I just wanted to get something. So require masks at the elementary schools, or it could be all schools, I'm more in the elementary schools, until the full vaccination rate in the city of Concord reaches 70%, and or until a vaccine is available to elementary school children and a sufficient period of time has passed to allow families who so choose to vaccinate their children.
I like that. I just think it should be, I can just see families that the mother with the illness that could make her die from COVID has a middle school student, a high school student, and elementary, and only the elementary has to wear a mask. We're still only 50% in Concord, so it's not, maybe there's more vaccinated people in the middle and the high school because some of the students are as well, but I just feel like, I don't feel comfortable saying this grade level has to, but this grade level doesn't.
Do you think setting it at a community vaccination rate in addition as a substitute for elementary school vaccination? So if you can.
No, I can say, I mean, I get it because none of the kids are vaccinated, so I understand that the need for masks is probably greater at that level. I just don't feel comfortable telling one group you have to wear masks and another group you don't. I just sort of feel like we all wear them until it's safe to not.
I think the issue that you were driving at, though, do we use the Concord vaccination rate, or do we say will all elementary kids get vaccinated? So which
I
one
see.
of those, you see what I'm saying?
Yeah.
So,
Well,
Or
I
do you
imagine
use
the-
both?
Yeah, I would say-
I would say if it's 60% in Concord, but elementary school kids can get vaccinated, then
Right.
I'd be okay. Then
Right.
that's a point I would say we
But-
can.
And yes, right. Or if the rate is like 7, yeah.
So
you use both.
it would be an or.
Yes.
So until Concord reaches 70%, or elementary school children can be vaccinated.
Because it might never reach 70%, because that's going to include,
exactly.
that's going to include zero, that's going to include everybody. Remember,
Yeah.
this is based on not just people who can get vaccinated, but every single body.
I would agree with that.
You would agree with the
70%
Or-
or elementary vaccinations are available.
Gina.
I'm sorry.
Gina has a
Jack thing. I'm texting, yeah.
So let me throw a monkey wrench in this. So instead of vaccination rates, community, which is, I was the one that brought it
Yeah.
up, but I fully understand that, but do we want to look instead of community vaccination rates at community transmission rates?
No, because now we get into the where was it? If it wasn't at school, why am I wearing a mask? Like,
Well, but you know how the map from Merrimack goes green, yellow,
no,
red,
that I
whatever?
understand.
Do we want to do it based, do you guys want to
But
do it
that's
based on?
how we've been doing it, and the whole question has been, well, kids don't get it at school, so why do we have to wear masks at
Yeah,
school?
are you talking about the community
Yeah.
in general,
Yeah.
Gina, or are you talking about school transmission?
Community in general.
Okay, yeah, we
Because-
don't know that.
Because we have no idea what I mean,
We know from Merrimack County.
Right. We don't have Concord, we just have
Right.
Merrimack County.
We have Concord rates of COVID. We know how many cases there are in Concord.
Right, but we don't know what the transmission rate is.
different.
Depending
Yeah.
on how many people are getting tested, and that's positive PCR. We don't know whether people who live in Concord, who might make the map green, but work in Manchester, and maybe that's where they acquired it. So,
Oh, right.
yeah,
That's why we
that-
use the county numbers
Yeah.
and the city numbers.
Yeah.
Yeah,
So
I see
maybe,
what you're saying.
I mean,
Yeah,
it's,
there's no way
it gets
otherwise
really-
to.
Yeah, so maybe
to do that.
maybe you do want to stick with vaccination. I don't know. I just threw that out there because you might have a really low transmission rate, and you still have a low vaccination rate. Possibly. I mean,
There's 900 million ways to look at this.
yes.
Right.
So I was just throwing out
Yes.
another way to
Yes,
look
well,
at it.
thank you, because we didn't have enough, I just, to me, the vaccination is just such a simple, cut and dry, clear,
So
What if the COVID rate gets really high? Like, what if we're insubstantial?
Well, we could
Do we
add
become
it-
more worried or not? I mean, we may not.
I mean, we could add a requirement that it could be my concern is trying to answer the question of like, there should be a point where it ends, but it should be a point that people understand so that they're making a decision that they're comfortable with that, sending their kids to school. I think you could add a line that says if community transmission reaches substantial levels, the mask requirements will may continue.
Right. Yeah, and that would be the asterisk of why would we not take masks off when the vaccination rates were high enough, and that would be a reason.
Yeah, if
Because-
there was some really awful variant that
Yes,
cut
right.
through the vaccinations, we just
And
don't
then it's
know
just
where
common
that's going.
sense, but
Right.
on July 26th, we can't predict what November 15th will look like. So I think.
I mean, although it scares me in that when you look at like the 7-day rolling average for the state of New Hampshire, we're actually very similar to where we were at this point last year for the 7-day rolling average. So it's not going to be quite as high, but
Right, right.
We had very few cases last year
Yeah.
at this time,
We-
and in
we-
September for that matter
Yeah.
too, and in
we
October.
knew
Yeah.
we were down to like 19
We
cases
had
in
almost no
September.
cases in September and October, so, yeah.
But
But
the
it's a different
fear,
time.
it
Yeah,
was
it's a different
it was different times, and people didn't have all the information that we have now.
Well, and people weren't vaccinated.
Right.
Wasn't available this time last year.
So I liked what you read, Pam. I don't want to separate. I think we all wear them to start. It's just,
And I would disagree.
I know you would.
So I wouldn't vote for that. That's fine.
I'm going to just email this out.
Yeah, would you do that?
To
Kate, do
everyone
you have a
in-
position on this? What are you thinking here?
School.
I'm mostly concerned about the elementary school students wearing masks. I want them to be masked. I wanted them to be masked during the summer.
Do you agree with the 70% or the elementary vaccinated that the masks can go away?
It's hard to answer, isn't it?
It is hard to answer. The
Well,
70% vaccination rate in the community, that's what that one is?
In the city of Concord.
Yeah.
Yeah, see, I can't tell you what school is, because I
Yeah,
have no
we
way
won't.
of knowing that information. But if the statistic of 70%, from everything that you hear, does provide that level of that quote-unquote herd immunity,
Right.
and less transmission, less chances for people to catch the virus.
The reason I like elementary is just because I think that is easier. I get your point about like mixed households and that, a kid at an unvaccinated kid at the high school. I do think it is easier for the reason that we're doing this to protect elementary school students and their families is easier for the community, to understand. Not that people who are vehemently opposed to mask wearing will necessarily agree. I don't think they will, but I think for the general public, some of whom are like, I was really good for a year and a half and now I would like to be rewarded. I mean, listen, I was very happy. My masks, now I have to remember to wear. oh
Yeah,
my
forget-
goodness, do
they're not
I
allowed
have
to
one
use my car
with
anymore,
me?
yeah.
So I understand, like, I've also been impressed how good the kids are, especially the little kids are, about understanding the importance of protecting their classmates. So.
Well, summer theater, RB Productions this summer, every actor and actress had a mask on, everyone in the audience had a mask. It was the only way that the Capitol Center would do it.
Yeah.
It wasn't the best, but no one really, I mean, plenty of people complained, but it was fine. It would, and that's what had, now, granted, if you don't want to do it, don't sign up, it's not like that with school. But I just feel very uncomfortable, assuming that, I don't know, I just feel like we should just all be wearing them.
The other thing about the high school, too, I want you to remember is that we have 9 different communities who all feed into our high school in CRTC. So just keep that in mind. And that's why
I'm not sure if that's an argument for or against.
No, 4 masks.
4 masks.
Yeah.
So that we protect everybody. Because I have no idea what the rates of vaccination are in those communities. I have, it's really undetermined.
And a substantial number of students, so.
Yeah, you're talking 600 and plus
Yeah.
students in there every day.
Yeah, well, maybe 4-ish from, the other
Well,
ones are
the-
less, right?
yeah.
We got a couple hundred.
Yeah,
And then
that's true.
But
Yeah,
400, but
that's
still,
true.
it's still a
That's true.
large,
Yeah.
still a large
Couple
number.
hundred of ours,
Large
and then the
number.
rest are students coming in.
I sent it around to everyone, so you have it written in front of you. Oh, except for Eugenia, I'm sorry. I was like sort of on autopilot with committee member. Oh, no, I did include you. I'm better than I thought I am.
All right, I'm gonna put it up.
I really don't want to, I feel it needs to be district-wide. You can all vote no on it, but I don't feel comfortable making a motion as the instructional committee chair or supporting a motion that excludes 2/3 of our district. I just think it should be Concord schools.
So if we vote on that and it doesn't pass, would you then vote on it the way it's written? Could we do a vote on it that way?
I don't know, I don't know, we can vote 100 times.
But so then it's your way or no?
No,
is what I'm
that's
hearing.
not what I'm saying at all.
Okay.
Perhaps we go to the board and say, we couldn't, we
Couldn't come up with-
didn't
yeah,
have
okay.
anything that
And
we all
you've done
supported.
that. You've done that.
We've
where you've
done that
not-
before, a lot's been put on this committee with COVID, and there have been times that we're like,
We don't know.
But I do think the rest of the committee does look to you for a
no,
recommendation.
I agree.
Yeah.
Is there a reason that are you all comfortable excluding the middle school and the high school? When I think of CRTC and, our families with health issues and stuff, I don't know.
I would like to hear from the administration
Yeah.
on this.
You've been waiting for this,
I'm
haven't
waiting,
you?
come on.
Yeah, I wanted you to have this discussion tonight. I think I was clear with you last night that I really felt you needed to do this. But I've taken the position that I think we should wear masks when we return to school until such time that our students are vaccinated. We have no idea how many students at the middle school or the high school have been vaccinated. And I've got to think of the students, of course, are my priority, but also the teaching staff and those folks that work there. So I'd rather start out in a more cautious way until we feel comfortable with the numbers and the vaccination rates.
And are you comfortable with setting a community vaccination target as a time to
I do, because I
relook?
think that's what everybody has. 70% sort of has been the point that people have used in terms of that being really keeping the virus down. Again, we want to watch the variants, but they seem to be holding against the Delta variant right now, with the exception of some breakthroughs, and we've seen that. We've had breakthroughs here. I mean, there's people who have been vaccinated, but for the most part, it's very, very limited.
To take to the board for discussion
Yeah.
purposes.
So can we just keep it simple that we support, I could potentially say, I move that the instructional committee support the administration's stance that masks be mandatory at the start of the school year until such time as we have 70% vaccination rate in our community.
Or
Or our elementary.
Or the elementary vaccine.
Yeah, because you want to be careful because you might never reach 70, especially if they're talking zero, starting at the age of 0 and up. Because a lot of, the decision about making a vaccination or giving a vaccination to young children is still out there, right? As an experimental.
Okay.
it should say masks will be required indoors, probably, and I'm willing to support at all schools for just to bring to the board for further
'Cause it could-
discussion.
Right.
You know, there's
I
only 4 of
want to
us
still
here.
continue to have the youngsters be able to have mask breaks. That often meant that they were going outside. We saw them. The teachers would take them outside, walk during their playground time, their recess time. At the high school, we see a lot of our youngsters eating outside on the tables and in the courtyard. So I want them to still be able to do that. We see them taking their masks off when they move from the high school over to Memorial Field to do physical education or whatever programs they have over there. So
Can I get a clarification? So, what my understanding is right now that masks would be required at all schools indoors until the full vaccination rate in the city of Concord reaches 70%, or until a vaccine is available to elementary school-age children. But we won't know necessarily that the elementary school children have gotten vaccinated.
No.
That's correct. It'll be the same at the middle and high school. We'll be in the same situation as the middle and high school.
But we will know that they will have had the opportunity to get vaccinated.
It'll only be the opportunity.
But we already know the middle and high school have had the opportunity.
that's correct.
So all we're doing is adding that the elementary would have had the opportunity, not necessarily that they have done it.
That's right.
That just seems silly to me.
I could go either way. I see the point in that it is, even if they have been vaccinated, there can be breakthrough vaccinations, or if they're not vaccinated, they are places where large groups of people are gathering indoors, and they may be bringing it home to other people who couldn't be vaccinated. And I think we probably need to have further discussion with the full board. And I'm sure we'll hear from people about it on Monday night and before, but
Right.
for discussion purposes, I think it's an okay place to start.
So Pam, do you want this to be your motion?
It's fine. I'm happy to move it.
Okay, and I'll second it. We can have more discussion right now, which is not necessarily a bad thing. Really, when committees vote on something, it's not a done deal. It just means we bring it. So this discussion will continue on a much bigger scale on Monday night, which is what it's supposed to do. So we'll take a vote. If you don't support it, you don't have to vote yes for this. And if it doesn't pass, well, then we go to the board and say, here's what we wanted to pass, and let's have further discussion, which is the whole point of committee work and a full board vote.
So what should happen at the board meeting, I'll go over this with Jim, is that at the section where I report out on return to school, I'll do that, and we'll use the data that we have updated. We'll update it for Monday. And then there's an open mic time, right?
Yeah.
The community has a chance to have input, and then we'll make sure that your vote occurs or your decisions occur after all of that.
Yeah.
At the instructional committee
Yeah.
report time, right?
Okay, so
Okay.
it's been moved and seconded. Is there any more discussion before we vote? All right, so Pam,
Yes.
Kate,
Yes.
Brenda,
No.
and I say yes. So 3-1 to present to the board for further discussion and a vote, the motion passes.
Okay.
On another topic, I have one more slide. just to show you where we are with kindergarten.
Yeah,
This
yeah,
is good,
just
right?
enrollment's
So I
important.
gave you a few years back. So you saw the dip for October 2020. Obviously, that was the pandemic. We lost we had a lower kindergarten rate. As of July 21st, which is still pretty early for us, so there's still a lot of people to register. We're at 274.
Dang.
So that's really
So we
good.
can see
Mhm.
easily.
It's really nice. Yeah, it's really nice to see. So hard to know, exactly how many more will come, but typically we have kids registering in August.
Are we gonna, where are we in class size at Krista? How many kindergarten? 4?
There's 4, and we're watching it.
Yeah.
I mean, that seems
It's
really
all right.
close.
It is really
Like, you
Yeah.
get 10 more kids.
Yeah. She
5 more kids.
We've talked. She knows. She's big. We're watching, and that's what we always do, anyways. Pandemic or no pandemic, it's all about watching during the summer and then making adjustments, and then we have a contingency for that.
Right,
purpose,
same at
and-
Millbrook. I mean, I've got to watch that
and-
number
yeah,
up
Millbrook
there.
is good. Well, it's not bad. It's 7 because they have 7
Seven,
sections.
yeah.
I think so. There's 18 sections
Yeah.
total across the district. So
Well, that's exciting.
yeah, they have 7.
Right, and I'm hoping that that's somewhat of a message that maybe the enrollment will bounce back from the 2020 and
And
look more like 19 or
Mhm.
18.
I just saw in the paper this morning that there was a
Mm-hmm.
100,
Donna and I were just talking about
That-
that this
that-
morning, right?
100,
Yeah.
yeah,
Right.
new apartments
Right.
that
Yeah, in the
it's
South
Where?
End.
South
in the
End,
South End.
which
It's
would
gonna be
really
huge.
affect
Yeah.
Where's
Abbott
that
Downing.
On the South End, I'm not sure exactly where.
Abbott, the population has steadily decreased at Abbott Downey. They had been almost as high as Krista, and they were right around 400 some years ago, and they have had more of a decrease. But sometimes it's housing. Like I know that in this neighborhood right now, there's a lot of houses changing around.
Yeah.
And sometimes those happen at different times, so you see what happens in the South End, and then you see what happens over here. But so we'll see. But
Well, it'll be interesting to see overall enrollment numbers as we get closer
Well,
to
I'll
the
get
start
you,
of the year.
you'll
Correct,
have
we're
one
still
in
looking
your
at the
August
others.
packet,
Yeah.
but it's still, that's August 1, so this number's not too far off. So we'll get better as we get closer to September. Maybe I'll have that for your next instructional meeting. That will be helpful to you, won't it? And you
yeah,
have
we'll
that.
definitely have it for that. It's the school.
You'll have one on the 23rd,
Yeah.
so I'll bring the enrollment in for that.
Sounds good.
Okay.
Not that this is on the agenda at all, it just came to my mind, what's the word I'm looking for? Modifications for sports still in place, or are sports, has the NHIAA been in touch with us at all?
The only thing I did today was sign off on being part of NHIAA,
Okay.
so
Yeah,
I'm
so
waiting
that'll
for
come.
all of their
So that would be something
recommendation.
that would be helpful.
Yeah, after-school programs, co-curricular, all of that we'll bring in at the next time. But I anticipate that it'll look just like the spring, because all of the sports, with the exception of volleyball, is outside.
Right, right.
And volleyball is played in that very large, in
Yeah.
the gym. So
Yeah,
you're not in a small setting. But Steve will have a report for you.
As,
No, go ahead.
as we're talking about sports and things like that, can we remind all of the principals to avoid scheduling on Rosh Hashanah?
We just
and
talked
Yom
Just
Kippur?
working with it today.
We did that today.
One
Just-
principal last year said, well, we can't avoid every holiday, so next year we can have a meeting on Christmas.
Yeah.
We
So-
just talked about that today.
Back to school
Right.
sports night,
Right.
it's.
We're just sending those out.
Yeah.
Great.
I've got it all prepared.
Yeah.
I just have to look for other holidays to make sure I have.
Yes.
I'm thinking that perhaps because sports will start like the 16th of August, that maybe we have our instructional committee meeting a week earlier, rather than talking about how sports will be 10 days into them already having started.
Yeah, that's a
I
good
won't.
point.
Oh, you won't be around.
On the
If we can leave it, if that's.
On the, oh no, I'll be here on the 16th.
We could try to bring it to next week. I mean, I'm assuming
I'll
they
be
know.
a little
Steve
jet lagged,
Powell
but I'll be
already
here.
knows what the rules are for the fall. I mean, they're already
Is it,
practicing.
okay, so it would just be,
I don't think it's going to change that
Okay.
much. I mean, I haven't heard from Steve,
well,
but
I haven't gotten calls from parents about it either, so.
Right.
Right. Let's try for next week.
Maybe
Just
I
to
can
get
just
it-
bring the
yeah.
report in to the
Perfect.
board meeting
If
as
it-
part of
if
my
there's nothing
report, because that's
significantly
return to
different.
school, so.
Okay,
Yeah,
that's fine
can
then, we
add
can
some
just look
slides
at.
on sports.
Yep.
Yeah.
All right. Does anyone else have anything else? Okay. I'd look for a motion to adjourn.
So I move that we adjourn.
Is there a second?
Second.
All those in favor?
Aye.
Thank you.
You know, neighbors adjourned. Sometimes it's not a bad thing.